Hello, this is a message for someone who recently received some kind of diagnosis or medical opinion on some problem they have that they are not happy about, okay? And it's not just that it's a bad diagnosis, it's also that what they're telling you you are dealing with and the supposed solutions don't seem like solutions to you. You're not happy with the, do they call it prognosis? Like the options, the perspective on this condition you're dealing with, okay? And the medical opinions that you've been getting, okay? So if this message is for you, this is some kind of serious medical condition you've been dealing with for a long time. It could be anything. But what I'm getting is that they're telling you is chronic. Like they don't know how to fix it, basically, or there is no known solution. And so is that terminology, the chronic label, the sort of talk you're getting about adjusting your expectations of your everyday life and things like that. Maybe you're being offered painkillers rather than any solutions, okay? This is something I've been getting this message for a really long time, for like a week. And I've been having trouble getting myself to record it for several reasons. And one of them is because I've been in incredible pain, which I often am. And I never really talk about with anyone outside my husband. But I have a similar condition as whoever this message is for. Something considered chronic, something considered incurable, something I've had most of my life. Something they don't know much about. I have endometriosis. And I don't really talk about it because up until recently, it was widely misunderstood even by the medical community. And basically, the lack of options in treatment mean that I'm either in a lot of pain or I'm taking opiates, which I don't want to do. And I decided many, many years ago that I was not going to do. So then basically I'm just suffering all the time. And again, there's no real solutions. There's no real options. We could talk about that for a long time, but I'm not going to. The reason I brought it up is because it's interesting how this message kept coming to me. And one of the reasons I couldn't record it was because I've been in so much pain. Now that's something, I just deal with it. And, I'll take 800 milligrams of ibuprofen. It doesn't do much. I might smoke weed to deal with the pain. Those are the only two things I'm willing to do to cope with this horrible pain. And, I have really high pain tolerance due to other medical conditions and things I've dealt with in the past, to the point that I get tattoos and I don't feel anything. My body will be twitching because my body obviously feels something, but I'm so numb to pain, I don't feel anything. So it is shocking how much pain I'm in with endometriosis on a regular basis, because I wonder, I think someone with more normal pain tolerance, I've been told this by doctors as well, could have probably just accepted a, what's the word, hysterectomy, I forget how to pronounce it in English. Basically, that's the solution they offer mostly for endometriosis, is to just, remove your uterus and your ovaries. And they're not even sure it completely fixes it, but, that's the general fix for when it gets really bad. After a series of surgeries, it's a very complicated thing we don't have to talk about. But again, I kept getting this message that you, whoever you are in a similar position, you were informed of what was going on with you. It might have taken you a long time to even get anyone to give you a proper diagnosis. And by the time you did, you might have been deep into pain management. Okay, that's what I'm getting. And see, that's the thing that this message hit so much home for me, and why I was like, why do I have to give this message, right? Well, I'm getting you're a person like me, if this message is for you, that you don't want to be on drugs all the time. You don't want to take opiates. You don't want to take muscle relaxants. You don't want that. You also, yeah, maybe they're proposing a bunch of surgeries that could have minimal impact. Very invasive surgeries, similar to my situation. Maybe you're like not willing to try that either, you know? I had a very negative reaction to the only time I've been put under to take my wisdom teeth out. The only surgery I've really ever had. Well, I had some like skin cancer moles that were removed when I was a child from my butt. They were sliced out, but that was the only 2 surgeries I've had, and I wasn't put under for the other one. And I had a horrible, horrible reaction to being put under, to the point that if I can avoid ever being put under again, I will. I don't want to for any reason. So yeah, not a candidate for experimental surgeries. And that's what I'm getting. You're getting offered as well. Maybe some kind of experimental treatments or surgeries, things that would be really painful and lengthy. They would take a lot of recovery time. They would imply you're taking drugs you don't want to take. And so you are just not liking the position you find yourself in, right? And yeah, again, I can relate to that very much. I just keep on going in life, and you know, maybe people can tell, right? When I make videos and I look really drained some days, and like, it's because I'm in so much pain, right? But it's something that you sort of get used to, unfortunately. Now, it does wear you down. Some days I do wake up crying just from so much pain all the time, you know, and just the fear of not having solutions and not knowing what's really going on with your body and what's going to come out of it, right? So I'm getting that's what you're going through as well. And the message I've been getting, which I've been like, is this for me? Really, is this a collective message? By the way, look at the pooches. But yeah, I've just been really confused about this. And message I've been getting though is that right now, thanks to AI, there's incredible advancements taking place in medicine, and a lot of incurable diseases and conditions might just be a few years away from great breakthroughs that were not possible before due to lack of funding and research and things like that. Now, because of AI being integrated into the medical field the way it has been already, again, we're just really 5 to 10 years away from permanent solutions to problems that that are still now are considered incurable. So I guess it's hope for both of us. And yeah, I guess that's the message. Hopefully it was helpful.